Okay, guys, and welcome. We're going to be talking today about the total hip replacement. My name is Dr. Robert Wolkers, and I'm one of the physical therapists and owners of a clinic in Northern Virginia. So what we're going to do is we're going to break down the hip for you guys for individuals who have a lot of cartilage loss that results in them getting more of a total hip replacement, because once that cartilage starts to break down, you're going to start to have pain, and you're also going to have loss of mobility. So the area that we're going to be looking at here is going to be in at the hip itself. If I come in through here, you have the femoral head. You're going to have the cartilage itself wrapping around. Now, if I fade some of the other surfaces, you're going to actually see the joint in through there. It's a great structure. It's a ball and socket joint. So there's a lot of mobility at the hip. Flexion and extension. So that's bringing your knee up toward your chest. Extension is bringing your knee and your foot behind you. Adduction is kind of coming across midline. Abduction is taking it away from midline. Internal rotation and external rotation at the hip. So basically the structures here are going to be the femoral head. You're going to come down here into the bone itself. This big landmark right here is called your greater trochanter. Okay, and you have your lesser trochanter itself, which is going to be on the back side here. There you go, the lesser coming down. You have the three bones of the pelvis. So you have the ischium, you have the ilium, and then you also have the pubis itself here in the front. So there's the ischium, there's the pubis, and there's the ilium. Those three bones make up the surface. Now, if I come in through here and if I'm going to hide the femur, I'm going to expose the inside of the hip itself, which is going to be your acetabular ring. Your labral is located in through there, the inner surface of the hip joint itself. So this area here at the acetabulum starts to break down. Also parts of the femoral head, which is, if I click on these guys, let me do multiple, and then let me fade others. There's the femoral head, and there's the surface there, nice and smooth. Okay, now if I come in out a little bit here, excuse me, if I come out and add some muscles there, you're going to see your hip flexors, also known as your psoas and your iliacus, excuse me, your psoas major and your iliacus. You're going to come all the way down and through here. You're going to see your pectineus muscles, your adductor longus coming around the back side here, a couple of the rotator muscles, your quadratus femoris. You're going to see your adductor minimus. And then I'm going to add a couple more layers here. You're going to see more of the adductor magnus coming down through the inside of the leg here. You're going to start seeing some of the quad muscles appearing. So if I add all the quad muscles in here, there's your rectus femoris. You're going to have the biceps femoris, the semimembranosus and tendinosus here in the back at the hamstrings. And then you're going to start seeing the glute medius up top. People that are interested in seeing the piriformis, there's your piriformis muscle, and there's your glute muscles. Okay, so I'm going to switch applications here. For those of you that want to know, I am using the application by 3D Medical. It's called Complete Anatomy. So I'm going to switch, or this one here is Essential Anatomy. Complete Anatomy is a little bit different, but I'm going to be switching over here towards one of the applications I like to show my patients for a breakdown and exactly what the total hip replacement looks like. So I'm going to ride this out a little bit. So here's the surface of the femoral head. You got the acetabular ring. You're going to start to see the cartilage break down. Cartilage breaking down results in pain and results in loss of mobility. So basically what happens during a total hip replacement, there's some bone sparing coming in, and they're going to take off the head of the femur, shave down the acetabular surface, put that drill down in towards the femur there so they could put the stem in. So there's their putty or the cement coming in. There's the stem itself. And then you're going to have the ball coming on top of the stem. So there's your ball. Now here's your ball and socket joint. So then here comes the nice socket. They're going to add an acetabular surface. They're going to add like a little suction cup here. A couple screws going in. And then here comes the suction cup part here where they put on that surface, and the ball and the socket all attaches into that ring. Now with the new hip here, there's a couple different approaches. There's going to be the anterior, which is in the front. lateral, and then posterior approach. A lot of our patients come in seeing more of a lateral to anterior approach. We're not seeing a lot of the posterior anymore, but doesn't mean that it's not done. It's just we're not seeing as much as we used to, but then at the same time. So that's kind of like once you get your total hip replacement, why people have a little bit of pain in the hip is because they shaved down the femoral head, they carved out an acetabular surface, and they gave you a new ball and socket joint. So look forward to talking to you guys on some of the other videos. Check out our total knee replacement video also. And once again, this is Dr. Robert Wolkers with Haymarket Physical Therapy.